Good evening, and welcome to Live with the Levi Long Sickle Cell Association. My name is Kiana Griffin, and I am the owner of the Levi Long Sickle Cell Association. I am physically located here at 984 Orange Avenue, Daytona Beach, Florida. And welcome to Live. It's not exactly 5, it is 5:09, and I'm grateful that you all have decided to come on this evening with me. Excuse me for a second. I don't want it to die while I'm on here. Okay, so this evening we're going to talk about um, how do you know the difference between the traits and the anemia? And as if you've been following along with me, then you know that the trait is a percentage or a chance when you have the characteristic or the DNA from your parent. We all know that sickle cell comes from the trait of your parents. The disease is from the one trait from your mother, one trait from the father. Those two coming together can equal the disease. And there is a percentage of chance when the disease happens in a child's life. So it's so important that you all know if you have the trait. And that's a lot of times not known. Even the persons that I've met as of older, they're now adults. They don't know or have not known their status until something else happens in their life and they have to get tested. Then the end result comes to be they have the sickle cell trait. So the question tonight is, how do you know? So one thing I do know in reference to the blood. So with sickle cell, there's the type of doctor that is studying their blood or deals with their blood. They're called the hematologist. A lot of us may have a primary care doctor where we may go and get a physical. We may get, our blood work done. They'll send us to go to the lab to make sure we don't have diabetes, high blood pressure, our make sure our glucose levels are okay, that we don't have things going on in our bodies to make us become sick. So in the life of a sickle cell client, they have to see special doctors. They have to see one doctor called a hematologist or a blood doctor so that they can help them to make sure that their blood levels are steady. As you all remember, I stated within a person that has whole cells and our cells are circular, we don't have to have those certain doctors because we don't have those complications within our bodies. But those that have sickle cell, you have what you call sickle cells within their vessels. And I always use this as an example. When a vessel is this big, and then there's the blood that's changed to the shape of a sickle, tries to pass through, it gets stuck because of the shape. So where it gets stuck, it starts to form pain and it clumps together. So they have to see special doctors. They have to see a hematologist, as I stated, a blood doctor. They have to see oncologists. And then that word may sound familiar for those that are familiar with cancer. So that's why I believe sickle cell should be talked about as much as cancer because they go through similar treatment. They have to go and be seen and get treatment regularly, weekly from their doctors. They have to sit in the chair. And it seems like the same method as when someone goes to get dialysis. When a person that goes to get dialysis, they have to sit in the chair. They have to get things, the IV attached to them, and things transpire. The same thing with sickle cell. They have to sit in the same chair, and a lot of them have the same doctors. So, how do you know the difference? One thing I do know is a big thing before I talk about the difference. A big thing in reference to sickle cell is what we're trying to get out now in reference to blood drives. I know you've probably seen the red blood bus, or you've seen people parked on the side in a big area where they go on the bus and they can give their blood. So right now it's very important that you consider it or want to do it, have a mind. So I'm even considering it because there's right now a blood shortage. And when I did some discovery, blood drives and transfusions are very, very important for those sickle cell patients. Why? It really keeps them alive because the blood, and this is from their expression, it literally is replaced as new blood to them, as well as the blood transfusion is so important that it determines if they are staying in the hospital a couple of weeks or a couple of days. Can you imagine someone going to the hospital because they don't feel well, they're in pain, but then because of the necessity of the blood that they need in their bodies, they have to stay in the hospital for a length of time, not days, but weeks. And I've dealt with clients that had to stay in the hospital for even over a month. And I know you can just can't imagine having to have your loved one in the hospital, not only just staying there, but also having to go through ICU, And that's very, very important to know what you have in reference to the trait. So, to the recompense of this, it can be compared to having a pot of coffee all at once. So, the blood, it re energizes the sickle cell individual back to life, literally. It's important to not only know about sickle cell and the importance of it, but it's also important to engage in the possible well being of how to help a person that has sickle cell or the sickle cell life. The actual match, it helps the transfusion to be successful. How do you know you're a match? You have to get your blood drawn. And the same thing is with kidneys. When that takes place, a person that is looking for a kidney, a person that's looking for a heart, all of this has a part to play within our human body, which plays a part in how we continue to live and live well. The actual match, it helps the transfusion to be successful. And possibly there's a fear, which I know a lot is with me. That's why I don't have any tattoos, because I don't play around with needles. I have a fear of needles just because. I understand blood work, but when you're just getting a needle just because, it's a difference. But in this form, when you're helping someone really sustain life, have a longer life, it's really something to be considered. So, even though there is a fear of being afraid of needles, the courage and the well being, knowing that you're helping someone sustain a life, it really can take a place and a factor in you. So, within the sickle cell life, right now, we know that new treatments are being allowed. Sickle cell warriors are to live well into adulthood only with blood transfusions, with proper care. And with proper care, I say it's with dressing the part. In Daytona Beach right now, it is cold today. It's been cold all day today. And I'm going to make sure I check on my sickle cell clients to make sure that they dress the part, meaning have on a jacket, have on socks, not just their slides, but keep their feet covered. And that really helps in sustaining them. Also, there's a confusion within the medical community, meaning sickle cell clients are looked at as drug seekers, but because of the necessity and the excess pain that they have to have strong narcotics, strong drugs that help them sustain their pain. So the question I started out with, how can you tell the difference? So we're going to talk about the difference between the sickle cell traits and the sickle cell disease. So we know people who inherit one sickle cell gene and one normal gene, they are at the more disposal of having the sickle cell trait. So I would say in math, a negative one, which can represent the sickle cell trait, and a positive one that can represent the normal trait of a normal human being that doesn't have anything can equal the trait. So I would say negative one plus a positive one that can equal the trait. But we know in math, if you know math, that's equal to zero. A negative and a positive of the same number equals to zero. Also, people with the sickle cell trait usually don't have that symptom that the one that has the disease does. And that is true. I can relate to that. They may not have those symptoms, but as severe, but they do have some complications, meaning they can have dehydration. They can also have tiredness, as well as not feeling well all the time. When the weather changes, and I can relate to this. If you've had surgeries, you know when it's raining, sometimes you can tell it's going to rain. Your knees may hurt, your hips may hurt, your bones ache. And I asked the doctor this before. Why is it that when the rain comes, people that have pain in their body? And the simple answer is because of gravity. So when the rain comes down, it's a downward force. With gravity, gravity is force. So those that have had surgeries, that causes the pain in their bodies because everything is going down. That was the explanation given to me, and I hope I didn't confuse you. So, what else? Is sickle cell the trait the same as anemia? No, it's not the same, but they are similar situations, not the same. There are worse conditions when you have the disease, and that's why the blood drives that you're about to see coming forth very soon, starting in the month of March, you'll see the red bus coming around here in our area. Please consider donating your blood so that it will help our sickle cell individuals and families. It will help them to have better and sustained lives. It will help them to not stay in the hospitals as much, so we can compare 2 to 3 days to some weeks at a time staying in the hospital. What else can we see about the trait versus the anemia. How is the trait and the anemia different? The disease, occurs when the one parent has the trait and the other parent has a trait. Those two parents come together and have the disease. But then what happens when you have all of the children that have the disease? So that's a big, 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 big situation that happens. Okay, so it's 5:20. I'm going to see if I have any comments because I have a few more minutes on here. I don't have any comments as of yet. So if you do have any comments or any questions, please feel free to leave them in the comment section and I will definitely make sure I answer them for you. Even if it's on tomorrow, I'll answer questions from today. So there are many different um, ways that we can detect the things that are going on in the body when you have the disease. One way you know that you have the disease, you have pain. You will know you have the disease when you're born and you start having complications. With the traits, it's a difference. So that's the difference. The disease, it's very severe. The trait is minor. So remember these last things that I did say. When you have a negative one in math, that's like the trait, and the positive one is like whole cells. Those two parents come together. It's a lesser chance for those children to have the actual sickle cell traits. I hope I said something tonight that will help you learn more about sickle cell. You've been live with the Leave Alone Sickle Cell Association, and I've enjoyed being on here this evening, and I will see you all tomorrow. Same place, same time. Have a good evening.